This is part 6 of our 8-part series that explores the ins and outs of identifying the best patient intake solution for your healthcare practice. Not all patient intake solutions are created equal, which is why it's important to know about the different program features, functionalities, and what to look out for. Once upon a time, the patient experience began in the comfort of the patient's home, back in the era when doctors actually made house calls. At that time, it was standard practice for a doctor or physician to travel to the patient's home to provide medical attention. Then, for the purposes of efficiency, a centralized physician's care model emerged in the 1960s in which the doctor remained stationary and the onus was put on the patients to do the traveling. It didn't take long for this new model to take off, and soon patients became accustomed to sitting patiently in waiting rooms, filling out cumbersome paperwork, which would create a back-end headache for the office staff. That's how it remained for 50 years. It eventually took a pandemic to initiate the next iteration of the healthcare practice waiting room, bolstered by a new wave of technology that allowed for the modernization of the waiting room experience at the same time. When in-office patient appointments were disrupted by quarantine procedures and lockdowns, a major shift occurred to the patient experience, affecting the entire industry. Old-fashioned pen and paper documentation gave way to digitized medical records seemingly overnight, making it easier for physicians to share information with colleagues and collaborate with other specialists. This streamlined both diagnosis and treatment options. Replacing the time-consuming mounds of patient-generated paperwork were new, web-based platforms that transformed the whole patient intake process. And, while it's no secret that compliance-related paperwork is a significant cause of long waits in the office, it's the providers and healthcare staff that spend most of their time managing their EHR and EMR systems. Today's new normal almost always begins online. Google searches that patients initiate, choosing a local practice based on user review sites, and conducting a preliminary telehealth appointment is typically how it's done. Patients do see value in virtual practice care if it's effective. However, many patients still value a one-on-one, in-person relationship with their doctor. Some things just can't be done over Zoom. So, practices need to strike a balance. That said, there's no need for patients to ever go back with a pen and paper approach to patient intake. Now, with pre-arrival patient intake systems that provide a host of user-friendly amenities such as enabling patients to schedule their own appointments, complete registration, and make payments ahead of time, practice visits are less time-consuming and more efficient. The patient experience is improved. Typically assessed by cell phone, computer, or tablet, secure online patient intake solutions eliminate waiting room times, limit the spread of contact with others, and increase financial results for small to mid-sized healthcare facilities. Automated solutions like the ones that Yosi Health offers can handle patient intake, registration, and other paperwork, which allows providers a chance to focus their efforts where it matters most, on their patients. At Yosi Health, we use the latest technology to assist any healthcare practice by streamlining operations with a state-of-the-art, pre-arrival patient intake and registration system that enhances the waiting room experience. It helps eliminate wait times, improves the patient experience, and increases financial results and staff burnout for healthcare systems. To learn more about our patient engagement platform and Yosi Health services, please give us a call.